And recording. Go ahead. Oh, go ahead.
Hey everybody, thanks for joining us on our study group Q&A session. Let's go ahead and fire away with your questions.
Go ahead, Laura.
Hey Laura.
Hi Greg, how are you?
Doing good.
Good. I like the protocol you put in the newsletter this week, and I want to ask a little bit about that. Is the practice stronger if you do the entire cycle with all 4 of the angels, or could you do the mugwort and artemisia and just one of the angels, or what?
You could do one, but like when you start the process, the idea is to do all 4, and
Okay.
so you don't have to do them all in one sitting though. Like sometimes you just go really deep with each one, but like over like say a week or two, do all 4 at some point.
Perfect.
It's very strong, by the way. It's very, very strong.
Good.
Yeah.
The second question, and I should know this. I'm getting ready to order either rose or carnation or both, and they're a little pricey. And I looked up what rose was, and I remembered why I was attracted to it, but I couldn't remember carnation. What are the properties of carnation?
Oh, the properties. They're kind of similar. Both are activating the heart. The carnation's a little bit more activating to the crown and the forehead. Carnation's probably a little bit better for stress, like releasing stress. And stress can have many forms. There's some stresses that are more due to not even like unconscious things that we would be doing like day to day, but like even when you do meditation and you have like a really deep inner experience, that actually causes a little bit of stress in the body. Whenever you're releasing something, for example, that actually causes some stress in the body. And so carnation is a little bit better for those kind of more abstract ideas of stress rather than just normal everyday, got to meet the deadline, got to drive through traffic, those kinds of things. Both are activating to the heart, but carnation a little bit more to the crown and the forehead. Yeah. And if you're looking for a good solid, because rose can get crazy priced, but the absolute is a really good budget way to nail the rose.
Perfect. That's exactly what I needed to hear. Thank you.
Yeah, you got it.
Anybody have any questions? Any shares?
Okay, well, we'll do some practice. But we haven't done that in a while.
But no, anytime if you do have something come up, if you have a question come in, just let us know.
Give me a second here. And
yeah, go ahead, Barbara.
Hey, Barbara.
Thanks, really quick. I had gone a nice long stretch without any what I call plant prana oil hangovers, but the past 2 days they're back.
Yeah.
I'm inclined to attribute that to the work with Archangel Michael on Saturday, but
probably. Yeah.
Okay. Or the accumulation of the last few weeks of work, or
well, that could be too. Like the thing with the Michael class is we didn't use a lot of blends. It was a lot of single oils and everything, and it's still really super intense.
It seemed like it took about 36 hours to really.
Yeah, I was going to say it's not so much about the oil, but it's the connection with the angel. It has an impact. It's not just in that afternoon you're making connection. I mean, you're increasing the connection that kind of gains some momentum. And so it very well could be from that one day class with Michael. And so Like, tell me some of the symptoms or some of the difficulties.
Oh, mostly just energy moving in very strong patterns in my brain,
Yeah, that's
and a
the
kind of
microclass.
a
Yeah.
swirling, in a swirling sort of pattern. Usually
Yeah.
it's more of a back and forth, but this was kind of a from the bottom of my brain up towards the top, like it was circulating, which was a different sensation. I don't. That's why I
That's
kind of attribute it to my.
probably the microclass.
Okay.
Yeah. Whenever that's happening, like just keep the energy moving. So a couple of things you could do. One is salt baths, especially like using chocolate root cleanser or Palo Santo, hyssop, something like that. Rue. Rue is especially good for working with Michael. And then
Would you say just another bit about that? It was on your maintenance piece, but it didn't get to ask.
yeah, like some of what's happening is with Michael is you are disconnecting from, you could say, negative connections with people, but you're also disconnecting from negative thought forms. Could be thought forms that you've like attached to from other groups. It could be thought forms that you've generated over a period of time. And the tendency is for those thought forms, the ones that are attached to like a group or something you generate over a long period of time, they impact the navel and the back of your head. And
Okay.
so yeah, does that kind of fit with what you're talking about?
Yes.
Yeah. And so you're releasing them, but even as you release them, going back to what Laura was asking, it causes a kind of stress. And sometimes if there's really like a lot of attachment to it, it actually causes a little bit of trauma. And it's a kind of trauma that when we think of trauma, like, somebody hurt our feelings or somebody yelled at us or, did something, that's kind of lower emotions and higher emotions. But this kind of trauma is very like low, like it's tied in your physiological responses. And so that kind of trauma actually doesn't even respond quite as well, even like with helichrysum and poplar. One of the formulas that we used to use in the pain class, we used to use it. Then I kind of faded it away because I thought it just made it the pain class a little too complicated. And we did have it, I think, in the Golden Flame class, but there's that blend Gilead. And let me give you like even a single oil choice. Give me just a sec here. St. John's wort would work, bluegrass would work.
African bluegrass?
Yeah, African bluegrass, St. John's wort, even mastic would work. And they would help to release some of those really low traumas, the lower physiological, it's still emotion, but it's physiological emotion. And so when you're releasing some of these things, especially things from the lower chakras, the normal psychological like approach is not quite as effective, because it's a very low part of the emotional body. And so it's more like, you could call it like almost like a primal part of the emotional body. And so usually it allows for greater activation of the blue pearl and the crown and the spiritual cord, but there's a little bit of a process of letting those things go. You might feel a little weird sensation down in the gut, especially more of the lower gut, or like you said, you feel sensations moving around in the brain, especially more in the backside of the head. That tends to be more of the primal part, but you can actually get it in the prefrontal cortex as well. Anytime that the the primal part of the brain shifts around, it directly impacts the prefrontal cortex. So it's almost like this, like one thing happens and then it starts to trigger something else and something else. But like the triggering is more of a triggering of releasing. And so it can be at different paces for different people, but can be very, very potent. And so in a way, it's a way of breaking patterns for a person. There's a lot of different ways that you can break patterns, but this would be one of them. Yeah.
Thank you.
The angel work, I mean, the angel work can be very intense. Like it produces a quick result when you start doing the more stronger practices. But at the same time, it's like you almost have to have either done some preparation or the skill set to deal with the stuff that kind of can pop up, because it can just make you start expelling in ways that are borderline uncomfortable. And so we try to temper it the best that we can. And we haven't rushed into anything, but when we start getting into the stronger practices, I mean, it starts to be, serious what we're doing.
So I was thinking I should maybe use some of the oils that worked on the brain, like either four lobes or the vital centers, but it sounds like it's really more about releasing the lower emotional.
Yeah, you can.
Going at it from the
the
wrong.
four lobes helps with certain kinds of transmutation, especially transmutation of like letting go of like kind of your personality of sorts. The transmutation that goes from the basic to the spleen to the Ming Men up to the crown. That transmutation is enhanced by using the four lobes. And so not a bad choice there. But Rue can be very, very helpful here, like very, very helpful. It doesn't really help the practice itself. Like when we were going through, there's the segments that we use the oils for different things during the practice, but the aftermath, Rue is very, very helpful.
The cleanup.
Mm-hmm, mm-hmm.
Thank you so much.
You're so welcome.
Go ahead, Beatrice.
Hey, Beatrice.
Hi, Greg. Thank you, Samantha. How are you, Greg?
I'm doing good. How about you?
I'm good, thank you. Looking
How's
forward to.
How's the Northeast up there?
It's cold.
Yeah, that's what I
Very
hear.
So, but anyway, looking forward to having you both in April, hopefully.
Yeah, we see you in a little over a month.
Yep. Okay. So, I have a question, and maybe, well, I think this has been asked before, and it's in reference to prostate cancer.
Okay.
My ex boss, he's around 80 years old, and he's been diagnosed with that, and he did go through a series of chemo, and it went away, but then now it's back.
Mhm.
And they're suggesting that they do some sort of hormone,
Right.
something, and he's getting a second opinion because he feels that's basically all chemical. And so I wonder whether there's treatment for him, alternative treatment, whether it's with essential oils or herbs, maybe.
Yeah. On the good side of it, it's a type, there are inflammatory types that grow very, very fast, but most prostate cancers grow relatively slowly. And so, sometimes they don't even do the chemo. So it must have been actually pretty progressed for them to do chemo given his age.
Yeah.
The goal is like if you can slow down the growth, because it's such a slow growing tumor to begin with. If you can slow it down, a lot of times, given his age, again, it's not going to be the thing that probably, ends his life. It will be something else. And so you try to keep him as comfortable as possible. Like hormones is something that they do sometimes. Chemo, I mean, if it's real severe, they'll do surgery. It's not blocking his urinary tract or anything like that.
It doesn't seem like it. He's still pretty active.
Okay, and he has a healthy flow of urine when he goes to the bathroom and all that.
Yeah, he just goes more often.
Yeah. Okay.
Yeah.
I mean, several things have been tried. Saw palmetto in relatively big dosages has been tried. There is a Chinese formula. I don't remember the name of it, but it was made for prostate cancer, and it was just 4 herbs. And I remember skullcap being one of them, but I don't remember the formula. But it had been studied in China and had slowed the progression and actually even reduced some of the size of the prostate. I think they had some cures with the formula, but not enough to say that it was a standardized treatment for it. I mean, that's the thing with holistic things when it comes to cancer, is it doesn't produce a consistent enough result. Even when there's people who have a good result, there's a bunch who didn't. And so it's not always as straightforward as that. There's so many factors to take into account. And so yeah. How's inflammation levels in his body? I'm just curious.
I'm not sure.
Yeah.
He does nowadays, especially after the chemo treatment, he tends to get tired.
Yeah, that's the chemo. Yeah, that's the chemo.
Have you ever treated cancer, and I don't know which type, with frankincense or myrrh?
Yeah, a company released a bunch of data saying that frankincense, had an effect on tumor growth, but they did something a little bit misleading. The issue is that the frankincense was being studied, but it was boswellic acid that was being studied in the frankincense, and the frankincense is not. Boswellic acid is not present in the essential oil. It's only present in a alcohol extraction, and it's an alcohol extraction of trying to remember the report. I want to say it was frankincense serrata, and it hadn't even produced a result. They were looking at it. And so they were looking at it in animals, not in humans. And so when the report came out, it got put out that was a treatment. And frankincense is really good for. Frankincense is one of the, if you look at the application of why somebody could even go there, is frankincense is very good for an inflammatory response that is overstimulated. And when an inflammatory response is overstimulated, you can have a buildup of plaque in certain areas, especially in the brain. You can have allergic responses, but one of the things that it can do is it makes it easier for cancers to grow. And so, even when that report got released, the only reason I got my hands on the report was there was the theory that was starting to float around in the essential oil world. And so, I was curious. I was like, if this is a viable option, then, I contacted some like biochemistry people in the industry, and they were saying probably not, and somehow I got my hand on one report from one of them, and it was being looked at, but I started thinking it out as like I could see how you could use it, like things like frankincense, black cumin, galbanum, even ginger. All of these have an effect in an overstimulated inflammatory response. And so, you look at, is the person achy a lot? Are they having a lot of poor muscle tone? Is the skin like losing tone? Like you can see inflammation a lot. Like if the superficial tissue like lacks a lot of tone, you can see that. Are they having a lot of inflammations in the joints? Are they having inflammation in their eyes? Do they get sick often? You start going through and looking at all the things that would go along with an overstimulated inflammatory response. And the theory would be that if you treated that, potentially it could slow down cancer growth. Probably not necessarily cure it, but definitely would slow it down. And I say definitely, and it's like I should say possibly.
Okay.
That's the thing with cancer is there's just so many factors, and there's strains that are just super, super aggressive. And so I always liken it to a bar fight. Most conditions you're trying to get the body back in balance to help the body heal itself. And cancer is one of those things where you really getting the body in balance is helpful, but you're also having to stop something that is replicating. And so it's different. And so, I don't have a really easy answer here, but things that are traditionally good are types of pine, Scotch or Sylvester can work relatively well. Yarrow, but that tends to be a little bit more for tumor growths that are more inflammatory in nature. A lot of times where I use yarrow is on inflammatory breast tumors. I'll have them put a bunch of yarrow on the spot and then like a moist cloth. And the moist cloth, the yarrow will move away from the water and you can drive it into the tumor site. So that's a possible option. And then relatively big dosages of lemon can kind of slow growths down sometimes.
And is that ingested, Craig?
Yeah, boy, it would have to be probably like 20 drops a day. I mean, it would have to be a big dosage. It doesn't have to be all at once, but I mean, it wouldn't be just a few drops. I mean, it would be substantial. The pine you could actually get away with probably doing it topically, just like, 6-8 drops on the wrist. The other thing, and this is probably more doable for your person, is do a combination of digestive enzymes, but in between the meals, not with the meals. And then pretty big dosages of maitake mushrooms. And maitake. Yeah, not shiitake, but maitake.
Okay.
And instead of buying capsules, I would actually buy go online and find the powder.
Okay.
And instead of taking like 4 or 5 capsules, I take like a teaspoon of the powder at a time. You can mix it in like coffee or water or something and then drink it. And maitake stimulates the killer T cells, and helps the body, potentially fight off the tumor. But it also goes to how strong his body is. And anytime you're looking at the body's ability to fight off like tumors and things, the other thing you want to look at is how well the lymph nodes are functioning. And so that's why I go back to the inflammation issue, is that if there is a lot of fascial inflammation in the body, the lymph nodes really will shut down. And so the way to reduce fascial inflammation is lemongrass and alcohol, and like rub it on or spray it on like a liniment, and then ingest bay laurel, or you can put bay laurel on like a knead application in areas. But here you're trying to cover a big part of the body, especially like down in the pelvis and things. And so my concern would be that there's lymph nodes down in the pelvic region that probably aren't functioning very well. You could try just giving them bay laurel without the lemongrass. That should be helpful as well. You can make it into like a medicated soap and have them take it internally, and even an ointment to rub it on. But the idea would be that the laurel helps to open up the lymph nodes.
Okay.
It's not solving the problem, but it's helping the body fight the problem.
Okay.
That's really what you're kind of trying to do with things that are holistic, is you're trying to help the body like fight it off. And so the maitake does it. The idea with taking the digestive enzymes in between meals is you're breaking down the like the outer layer. You could call it, it's almost like a protective layer around the tumor. And the theory was that if you took digestive enzymes like that, every time between the meals, and eventually get up to like maybe even 2 or 3 at a time, you keep breaking down the outer layer of the tumor so that the body, the killer T cells can actually attack the tumor site. And so you also have to factor in his age, his immunity, and how willing he would be to do a regimen. If he's pretty motivated, then you can give him several things. But if he's not into holistic things, I would pick 1 or 2 things and just try to get him to do it consistently, rather than trying to do a bunch of things. You know what I mean? Like, you kind of got to know your patient a little bit. And if they're not going to do a bunch of things, there's no point in making a big strategy, because they're just not going to follow it. And not right or wrong. It's just, it's just, it is where they're at. And
That's right.
so, yeah. And so, I always try to think of it as it's different from person to person. It's not like one situation is right or wrong. It's just, some people will go gung-ho at it, and some people, they can just do little bits and pieces. And so
He's normally not into holistic approach, but I think now he's kind of don't want to go that route where know.
Yeah.
So he's a little bit more open, and I'm thinking, what you're suggesting is right, that maybe just take 2 or 3 options from what you describe, and then have him do that.
And the great thing, like with the maitake mushroom, he could take huge dosages. Like, he could totally screw it up and take like way too much, and it wouldn't be an issue. Like, it just wouldn't be an issue. Like, how like lion's mane is really good for the brain, and you take like 2 or 3 or 4 capsules or something. I mean, we buy lion's manes that are like this big, and we chop them up and cook them and eat most of that in one sitting. We eat like, 8 ounces of it. Like, we eat about like 5 or 6 bottles of lion's mane. It's just,
No wonder you're all so brilliant.
we don't do it often, but we probably do it once a month or so, like where we dive into the lion's mane. And I mean, it's only been the recent like 6-8 months, year or something like that. But mushrooms are a great way to do mega dosing without having a lot of weird side effects.
Okay. And you mentioned 1 teaspoon. Is that just per day or?
You could start with it per day, but like if you could handle more, I would probably do it, twice a day, even 3 times a day at some point.
Okay.
Yeah. But again, it's like knowing your patient. The thing you're just trying to do here is when they're slow growing, right? They tend to be a really dense tumor. And so you're trying to buy time, you're trying to slow the growth because, I mean, this compared to a lot of other tumors, a lot of times, like my grandpa had it and, they were telling him all medications and he wasn't going to do any of it. And he had that cancer for probably 12 to 15 years. And when he passed away, it's not what killed him. You know what I mean? It was complications from another health issue. It wasn't even that. And so if it was super serious, they would have cut it out already.
Okay.
Unless it was just inoperable. And so that they're trying to treat it with chemo, they're just trying to buy him some time. They're not looking for a cure like you would if it was breast cancer or something, because breast cancer is, you got to jump on that.
Yeah.
But the prostate cancer, you have time to try some things. And, he still needs to see his doctor. He still needs to, monitor the growth and the growth rate and all of that stuff. But he can try some other things.
Okay.
I never tell them not to do their medical treatments because, that's a big responsibility. And unless I think I can produce a result, that's not my decision. But you can augment the things that he's already doing. And if he makes choices not to do his treatment with his doctor, you can still augment some things to help him along.
Yeah. Okay.
Yeah.
Well, thank you.
Lemon oil internally would be good if you'll take that big of a dosage. And pine oil would probably be my choice. Frankincense isn't going to hurt you. I mean, it would definitely reduce inflammation, but it's probably not going to reduce the growth rate. I have never seen it. I've seen some people use it for skin cancers, and like even for that, like orange oil works way better, and some balms, certain kinds of balms and things will pull out the tumors. But yeah.
Okay.
If
So
it's
I will maybe make him a topical ointment maybe for the wrist with the pine.
Yeah, you could do that. Actually, even with the pine, you could actually probably just give it to him neat,
Okay.
Or put it in just like a little tiny bit of jojoba, like more pine oil than jojoba, and then put it in like a little roller ball or something, and just let him, roll it all over his wrist, several times a day.
Do 50-50 or 60-40?
I would probably do like 70-30, like 70% pine
70-30.
oil and
Okay.
30% jojoba.
Okay.
Yeah, and do that. But still, I'd really like him to see him do really big dosages of Mataki.
Yes. Okay.
Yeah, that would be the big one.
Okay.
Yeah, Unfortunately, there's nothing that's really like kind of a tried and true, like this is going to do it and this is not going to do it. You know, there's not something that consistently produces a result in this arena. So you start trying things and you know, there's so many different kinds of cancers, and then there's, you know, different states that the body's in. And so sometimes what you're doing is you're trying to treat the cancer and address the deficiencies in the body, you know, that body has. And for cancer, one of the big ones is lymph nodes. So, you know, looking at lymph node function would be, just when I look at him a little bit, like his pelvis, like his thighs, even into his back and his spine, the lymph nodes aren't working that great, like in his lower abdomen. Is he prone to like diarrhea or anything like that? Do we know?
I don't know. I'm sure he probably didn't tell me if he did.
Yeah. Well, a lot of times, like there are certain things that people wouldn't even think are related, but like you're just trying to get like an overview of what the problems are, you know, because if there's been longstanding problems, it might have contributed to the growth. And so, you know, you just start looking at these things. And then did he have a real stressful job or a stressful family life or something?
He's my ex-CEO, so his job
so
was very stressful.
he had a stressful life. Even if he was chill, he had a stressful life. So I would also treat for some stress, you know, not so much that he's stressed out now, but the effects of stress. And you could go to the, you know, the PTSD, like the tarragon, rue, hyssop, splendor. That will undo the long-term effects of stress.
Okay.
Yeah, even if he doesn't direct it, he could just sit and inhale them, like, you know, just boom, 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 boom.
Yeah.
That would actually be beneficial.
Okay.
Yeah.
Perfect.
Yeah, stress is really hard on the lymphatic system, and the lymphatic system, you know, is part of how the body fights off cancer. And so, yeah.
This is great.
Yeah. So I hope that helps. As you treat him, and if you have questions or something, let me know.
Okay, I will. Thank you so much, Greg.
You're so welcome.
Go ahead, Kathy.
Hey, Kathy.
Thank you. I
Hey.
need to check in. I have a friend who is going in for hip replacement surgery on the 28th of March.
Okay.
He's 69. He's got bone on bone. High pain, of course, right now. High anxiety. Type 2 diabetes, post-polio syndrome. I suspect he had a early case of COVID. Both of us had exposure at our office back 2019, early 2020. And his sleep has been messed up since. He's pretty much been doing telehealth from home, but limited, and he up most of the night and sleeps a good part of the day.
Yeah. All of that
and
is
he's a Taurus.
Yeah, all of that's pretty normal for that condition. You know, the poor sleep, you know, high levels of pain. You know, the thing is, going back to the bone on bone, is at some point, you know, there's the pain issue, but the issue again is that starts to produce a lot of inflammation, and then for another reason starts to impact the lymphatic system and the lymph nodes. And then at some point, the inflammation and the lymphatic stagnation stops being localized and starts to be systemic, you know, and so it starts to spread throughout the body. And so usually with something like that, you know, you've got a surgery happening in about 5 weeks or so, 4 or 5 weeks. And
Yes.
so right now it's really kind of trying to minimize the inflammatory process and keeping them as comfortable as possible, and then post-surgery unwinding the effect of the surgery. The good thing is that that surgery is something they really have down. I mean, I mean, he is going to wake up and he's going to have the pain of the surgery, but that pain that's grinding in his hip is going to be gone.
Yes.
And, you know, most times they have them standing the day of the surgery. You know, they're not walking, but they're standing.
Right.
And usually within about 10 days or so, you know, he'll probably be cranking out a mile or so. And so couple suggestions. First off, to prep for the surgery, and then after the surgery. And so right off the bat, have him start doing this now. Is for one, in his house, have him start going around and moving everything up high. You know, because are they going in from the side or are they going in through the front?
Front.
The front. Okay, so he's going to be able to bend a bit, but I'd still have everything moved up a little bit so he doesn't have to bend as much.
Right.
And then, you know how like if you go to Home Depot or Lowe's or something, they have those little aprons that you can tie around your waist that you can throw like nails and, you know, the little things that's got like 2 or 3 little pockets in them.
Right.
That's his new best friend for about 4 or 5 weeks after the surgery. Like every day he's going to wear that. It's going to have his phone. It's going to have a you know, a little tablet, a pen, you know, his keys, whatever it is. So he doesn't have to get up and walk. You know, if his medicines, whatever it is, they're going to just be in that little pocket, and wherever he's at, you know, it's always going to go with him. I mean, it will be a lifesaver for him. And then the combination of black cumin internally, and then separately take some galbanum internally, and 2 to 3 drops. You know, you could do once a day, but if he wants to do more, he could do more. But like give himself like a good week to get used to taking that. So, you know, put him in water. It should cut the pain down a little bit. You know, not completely, but it takes the edge off. Like nothing really takes, even strong narcotics don't take the pain out. It just like kind of dulls it. And so you're doing that. One of the things that I like to do with this is I like to try to calm down you can try putting things on there that will minimize the pain, but part of what's happening is because of the lymphatic stagnation, the sensory nerves are like hyper excited. And so even if you are able to calm the pain down a little bit, part of the issue is those overexcited nerves, they just won't stop what they're doing. Like, you know, they just stay in this overstimulated state. And then after surgery, they can cause more pain. And so you have some choices there. And I would have him rub this on like 1, 2, even 3 times a day. Is you have like sage will do it. A lot of times I use Spanish sage because you can do really big dosages of Spanish sage. The chemistry is a little bit different than normal sage. And so you can do much bigger dosages of the Spanish sage. Another one is you could use vetiver. Vetiver would do it. Sweet basil will also do it, like calm down the sensory nerves. And then there's that blend that we make, nerve help. I mean, that's what it's for. It's for calming down and helping to re-educate how the nerve is firing. Because the way that the nerve works is once it like fires down the wrong pathway, when things change, it doesn't go, oh, let's go down this other pathway. It just keeps firing down the wrong pathway. Like it doesn't stop doing what it's doing. And so it's a way to calm it down and then help it to re-educate to go back to like proper functioning. Anything lymphatic is always helpful. You could have him take Bayloral internally. You could have him apply Bayloral topically. You could have him use chakra root cleanser topically, lymphatic blend, the pepper supreme actually helps to unwind the fascia a little bit and helps move the lymph. You know, because like when you're looking at lymph, there, you know, the lymphatic function, there's the detoxification process, there is the component that's tied to like synovial fluid, there is the lymph nodes, there's the vessels themselves, but there's the rhythm of, you know, the circulation of the lymph. But a thing that often gets overlooked is the viscosity of the lymph. You know, it's basically the thickness. And the different peppers are helpful for that. And what is it that I use for that? Let me look that up. Oh, Palo Santo fruit. Palo Santo will do it, but Palo Santo fruit especially will do it. It basically makes the lymph fluid like less viscous. It makes it like thinner and like easier to move, which means it circulates better. Like you're able to move the lymph in and out of that area quite effectively. And so he can apply that on the section, you know, multiple times a day, and it could be very, very helpful. And so I would do that before, and then once the surgery's happened and the wound is closed, helichrysum needs to go on the side of the incision, you know, after the incision is closed. That will reduce the scar tissue and reduce the amount of physical therapy that happens for the scar tissue. Because what you're really calling scar tissue is not necessarily the incision, but it's like the lesion that happens in the fascia after the fact, which reduces the amount of blood that flows in the area and the amount of lymph that flows in the area. So if you can reduce that lesion, then blood and everything moves easier, and the scar gets better, it doesn't get as thick, it's not as painful. So as soon as the wound closes, I usually have them put on helichrysum like immediately. And it is, for scarring, it is a game changer. I mean, it is such a game changer. You know, there's some things where sometimes it works, sometimes it doesn't. Helichrysum always works on a scar. I mean, always. I'm the only adverse thing that I ever saw happen was someone who was Chinese put it on, and it made a small portion of the scar turn a little bit darker, like and it wasn't even the whole scar, it was just this little tiny section, and it didn't turn it like black, it just made it a little bit darker than the skin. That's probably the biggest adverse reaction that I saw. The scar still got better, it had that little discoloration. And other than that, a lot of times with hip replacements, I've used it with hip replacements probably 100 times, you know, 100 different patients, maybe even more. And it reduces the scar tissue, I mean, within a week or two of treatment. I mean, it's just first application, it starts to change it, but within a week or two, like you don't even have to keep treating it. It's just like, it's almost kind of done. And so a lot of times they'll do what they call like friction massage after the surgery, where they go through and they do like really kind of aggressive back and forth to kind of irritate it to the scarring to get blood into it. A lot of times they don't even have to do the friction massage. Sometimes they'll do it because they know they're supposed to. But if they get in there and start checking it, it's usually not necessary. And so I would do the helichrysum, and you can put helichrysum on an open wound, but because it's a surgery, I usually don't have them do it. If it was like, if you got a cut and you put helichrysum on, it cleans up the wound, it actually reduces pain, and it helps the wound to close faster than normal. And so, we use helichrysum on wounds quite a bit. But because of it being a surgery and being so deep, and that they, went all the way to the bone and all that, I usually wait till the incision is closed before I do it.
Okay.
And then some bay laurel in and around the area to also make the lymph nodes start functioning better. Because, even after the surgery, you're still dealing with some stagnant lymphatic function that was happening in the area. So the things that you're doing prior, you can still continue after the fact. I would still continue with the galbanum for a little while afterwards, the black cumin. It will reduce pain. It will accelerate the healing process. It will reduce inflammation. It keeps the inflammatory response from being overstimulated. And, that's a thing that people don't really take into account. But just like how you get overactivated adrenals, you can get an not active, but like an overstimulated or a hyper reactive inflammatory response. And it usually happens kind of with age, or sometimes when you've had serious injuries or serious illnesses, or a lot of allergies, anything like that. It can make your body like hyper reactive. And so it's a way to calm down that inflammatory response. And so
Okay.
helping to get healthier faster and reduce aches and pains in other areas.
Well, thank you very much.
Is he complaining of aches and pains in other areas of his body?
His knee.
Yeah.
Yeah.
So treat that lymphatically as well. Be it bay laurel, or chakra root cleanser is for stimulating deep lymphatic movement.
Okay.
And so it's not just like an etheric cleanser, but it actually helps to stimulate the movement of lymph.
Okay.
And so you could put a bunch of that on an area.
Now, is that going to be neat or mixed in?
You could put it on neat. I would probably put it in like a lotion or a massage oil,
Okay.
just because it makes it linger in the area for a much longer period of time.
Right.
It actually will probably be a little bit more effective. But if you didn't have it, you could put it on neat. But I would put it in a base oil.
Okay, I would too.
Yeah.
Well, thank
And
you
if you
so
don't
much.
have oil, or if he doesn't like the idea of oil, put it in an alcohol, make it into a liniment, put it on the area, it dries, and then it doesn't make his clothes oily or something like that. It would still work.
Well, he was at one of Barbara's meditation things in Louisville, and you came and did a presentation. And so he's pretty sold.
Oh, okay.
Yeah.
Well, good.
Yeah.
Yeah, we're just there in a few weeks. So if there's questions, we can even, talk in person or something.
Oh, yeah, that's right.
Mm-hmm.
Very good. Well, I'll look that up and try to get us both scheduled.
Yeah, I think it's the second weekend of March.
Yeah, that would be awesome. Thank you.
You're so welcome.
Question in the chat.
Mhm.
Does Greg have sandalwood incense he makes for sale?
I haven't made it yet. It's on my to-do list. Yeah.
In the classes of the directions, the psychic protection, inner transformation, wisdom of the heart, higher creativity, is it best to work them in a certain order?
No, you can work them out. Yeah.
There's CRC. Is there a truck roll web cleanser?
Protective web. Protective web works, and poplar balsam would also work for cleaning the webs.
What is the protective web?
The protective web is, so like say we're talking about the heart chakra, right? So the chakra like looks like this, but coming into the body. And so the surface of the chakra, right, is out here, and then you have the physical body, and it keeps going in the body all the way down to the central channel, which is close to the spine, right? And so in between the surface and the body is a little, like you could call it like a filter. And so it's how we keep energies from the environment out, but it's also part of it is like how energies can get stuck and held internally, like you're not able to expel them out, right? And so if you think about, like, if you had a coffee filter that you were using and you only had one filter and you used it for 2 years, 5 years, 10 years, think about how dirty the coffee filter would be. That's what happens to your protective web. And so the protective web is tied to your soft tissue and is tied to some of the sensory mechanisms in your nervous system, and it is an extension of the basic chakra, which has to do with your body, bone, muscle, blood, things like that, kidney function. And so when you're doing deep releases, both psychologically and just energetically, when you're doing meditation, when you're cleaning up from long-term effects of stress, one of the issues is the protective webs can be quite contaminated. And so by going through and kind of cleaning up the webs, it allows for energy to come off faster. And if you go, well, I don't know if I believe in the energy thing, think of it in your physiology is like types of agitation that happens in your physiology is actually tied to these energetic mechanics. It is an extension. You could almost say it's like a sensory organ, like how you have taste, smell, touch, hearing, sight. That is like an energetic sense around you. Like, haven't you ever been walking like down the street and somebody's looking at you and you look over at them as they're looking at you because you just felt something? Part of how you felt that is through these protective webs. And so it's like tied to your auric awareness or awareness of your surroundings. So, yeah.
Go ahead, Ralph.
Hey, Ralph.
You're unmuted, but we still can't hear you yet. Still can't hear you. Whenever you're able to get your mic back, just unmute yourself again and just ask away. What do you use birch tar salt scrub for?
Birch tar would be somewhat of a pain reliever, not quite like mint is for short pain, but for dull, achy pain. But it's also very good for moving lymph in the skin, and it's a good like etheric cleanser. And so you would use it for that, for moving lymph, for cleaning up the skin, and for helping to release energy. It's like a general etheric cleanser. Chocolate root cleanser would be stronger. Coffee would be stronger for just moving energy, but the birch tar is very good for stimulating lymphatic function.
Yeah, and go ahead, Ralph, again.
Hey, Greg, can you hear me now?
Yeah, yeah.
Okay,
you.
good. I'm new, seeing as I'm new to this, inhaling the oils and going through your classes. In some of my previous metaphysical classes, there's been great emphasis on when you're aware of the area of a chakra to see the chakra in a particular color or a particular form. In doing the oils as you're going through the processes, in being aware of the chakras, is there a particular way that's more effective, or just any
Just put your
awareness?
put your attention on it, and just inhale. Like the plant will do a lot of the heavy lifting. And
Okay.
so you're still, when you're doing the color visualization or you're visualizing like a symbol or something, part
Mhm.
of what you're doing is you're stimulating the intuitive part of the brain, or the right side of the brain,
Yeah.
and the plant is doing the same thing. And so a plant is just a variation of doing that. And the benefit of using a plant is when you go through and inhale, you're really tapping into the part of the nervous system, like the limbic functions and the olfactory system. A sense of smell is one of the strongest ways for you to shift things in your brain, and to shift like actions, behaviors, thought processes, things like
Hmm.
that. And so the plant has an energetic component to it that helps do that. But the added benefit, as you're inhaling the oil, the sense of the smell is actually particles that are going in to your respiratory tract, and then hitting the lung tissue or the bronchioles. And then as blood passes through that, it starts to be infused into your bloodstream. So you're
Okay.
actually getting a combination of like physical medicine and then energetic medicine. And when you
Oh.
combine the two, that's a very potent combination. For like acupuncture
Mhm.
would be the use of needles to move energy around, and then
Yeah.
you would give them herbs to do the physical component. With the oils and inhaling, you're kind of getting both.
Mm.
And so it's a powerful way of doing that. Like if you were doing it's a yoga practice you were doing, or a kundalini practice.
It was partially Kundalini,
Yeah.
partially was etheric surgery.
Oh, okay. So
So
you could still do kind of the same colors and symbols, and then you
Mhm.
could use the plants if you wanted to.
Yeah.
Or you could just do the plants by themselves.
Okay. So I grew up in Richmond, California, over top of an oil refinery. So
Oh, wow.
my sense of smell has been non-existent for a long time.
Yeah.
Will
Yeah.
that still will
Yeah.
with
Even
the
though you
oils
can't
still
smell
go in, even if I can't
even
say this is this,
right.
is it still going to be effective?
Yeah, it will still be effective.
Okay.
Yeah. If you want to rehab the sense of smell, it
Mhm.
doesn't work all the time, but your best bet is to consistently use basil, like
Okay.
some form of basil.
Yep.
Inhale it quite a bit, and over
Mhm.
a period of time, it can undo some of the effects where you had a sense of the loss of smell.
Okay. Good.
Yeah.
All right. Thank you.
Yeah, you're so welcome.
Okay.
I received my arthrocare. Do I apply it directly to swollen areas or dilute it down with some body lotion?
I would dilute it down with body lotion, or a massage oil or something, just because it will make it linger into the area for longer periods of time. And so, yeah, that's especially good for deposits in the joint. Does have anti-inflammatory properties, but it's really for helping to remove the debris in the joint that is causing like inflammation or the joint to break down.
Is there a best pattern for the protective web, for cleaning the webs?
Yeah, so there's a long form and a short form, right? The long form is you do all the chakras, you do all 11 chakras. And so, wherever you are inhaling and working with a protective web, like say you're doing between your eyebrows, and you inhale and your awareness is there, it's cleaning up that area, but not necessarily all the others. Now, if you put your awareness on the kidneys, it actually has a cleansing effect on all the protective webs. Going to each protective web is probably a little bit stronger, but if you want just a quick, fast version that's, in 5-10 minutes, you can really produce a result. Inhale with your awareness on the kidneys. I like that you're going into the protective webs. I don't know why, but I like that. I think the protective webs are very undertreated.
And that is it for the moment. Maybe more will come up, but we have about 20 minutes.
Yeah, let's do a protocol. Let's have you pull out like hyssop or tarragon. Give me just a second.
What is this protocol for?
We're gonna do a thing for soothing sensory nerve hyperstimulation. So you could also do sage. You could also do sweet basil. You could also do vetiver. So, like I said, hyssop or tarragon, spikenard, kava kava if you have it in the oil form, or the nerve help. Okay, so with that, begin inhaling. Your awareness is on the front solar plexus. This is really super soothing to the sensory nerves.
And you said the front solar plexus.
Mm-hmm. Front solar plexus.
For those people who may not know where the front solar plexus
It's
is.
below the rib cage and your upper abdomen. Long, slow, deep breaths. And then just be still for a moment, just let go. Just let go of everything, just let go. Just keep your eyes closed and be still. Begin inhaling again. You're still on the front solar plexus, which is below your ribs on the upper abdomen. In your back solar plexus, your mid-back area, below your shoulder blades. Just be still, be aware, just let go. Begin inhaling again. Your awareness is still on the back solar plexus, which is your mid-back area. Long, slow, deep breaths in through the nose, out through the mouth. Now move over to the left-hand side below your ribs. So the left side of your body under the rib cage. You're going to your spleen area. Just get somewhere in that general area. Start taking long, slow, deep breaths. Move your awareness to your navel. Just be still. Just let everything go. Just be still. Begin inhaling again. Your awareness is on your navel. You're taking long, slow, deep breaths. You're still in your navel. You're still taking long, slow, deep breaths. Just be still. Just let it go. Just let it go. Move your awareness to 1.5 inches below the navel. Move your awareness to the bottom of the tailbone. Your awareness is still on the bottom of your tailbone. Move your awareness to the soles of your feet. Just be still, be aware. Put your awareness on some part of your body where there's discomfort and begin inhaling. Keep inhaling with your awareness on that area of discomfort. Just be still, be aware, just let go. Let go of everything. Keep your eyes closed, just let go. You're not inhaling, you're just being still. Your eyes are closed. And as you're sitting there being still, keep your awareness on your feet. Your awareness is on the area of discomfort. And again, begin inhaling. Be still, be aware, just let go. Move around, notice how you feel. This is just a way to calm down some of the sensory nerves in the body. It allows the body to release some nervous tension. It's out of the sleep and memory class, by the way. And so we are going to switch gears and move to the angel study group. So we're going to switch links, but you're more than welcome just to follow us over. Keep your oils handy and we'll get busy with doing something in the angel group.
And I put the link in there. It's also in the newsletter for you. Hopefully we'll see you in just a minute.